Well, tonight, for the first time, we're getting an update on how people with heart failure are being cared for in the Portland area after OHSU suspended its heart transplant program last summer. It was the only one in Oregon, so right now, patients who are in need of a transplant are having to travel out of state. But there is a lot of care they can still get right here at home. Fox 12's Kelsey Watts joins us live tonight with how doctors at Providence are picking up some of the workload. Kelsey?
Well, doctors here at St. Vincent's tell me they have taken on some 350 OHSU patients over the last 6 months. These are people who have already had transplants and need continued care or have other heart issues, devices like pumps, for instance. And leaders of both OHSU and Providence tell me they are now working together to try and reopen a local heart transplant program right here in Portland.
It was really in a critical stage when I actually reported to the emergency room.
Karanjit Samra has congestive heart failure. Right now, this pump is the only thing keeping him alive while he waits for a transplant. His case was referred to OHSU last year, but then he got some bad news.
I got a call from them that they're no longer able to accept any new patients.
OHSU suspended its heart transplant program over a lack of staffing, and hundreds of patients like him were referred to Providence for care. Now he's on the transplant wait list at a Seattle hospital, and he'll have to stay in Seattle for 3 months or more after his surgery. He could get the call at any moment that it's time to go.
I was afraid of just the logistics of going to Seattle and coming back. Fortunately, we have family in Seattle.
It's important that we have a local transplant program for our community and for our patients.
Dr. Dan Oserin is the executive medical director of the Providence Heart Institute. The team at Providence has already been taking care of heart failure patients for years, but now their workload is even greater. They've taken on some 350 patients from OHSU and continue to do their own referrals and evaluations to make sure people who need cardiac care are getting it.
Everybody at Providence is from physicians to nurses to clinic managers have really stepped up to accommodate these patients.
Right now, he says their team is working closely with leaders at OHSU to reopen a heart transplant program in Portland. And conversations are underway to figure out what that would look like and when it could happen. For Sambra, he hopes it's soon. If not for him, then for others who have a heart that needs some help.
They are very good people up in University of Washington, but having it in your own city, in your own state, is definitely a better prospect for everybody.
So for the meantime, Providence is taking care of a lot of OHSU's patients. I also spoke with the chief medical officer at OHSU today, and she tells me they are actively recruiting right now for new heart failure transplant cardiologists, and they've already had several doctors go through that process. She says they want to have 4 in place before they reopen a local program. Live in Southwest Portland tonight, Kelsey Watts, Fox 12 Oregon.